As you prepare for your joint replacement surgery, Rehabilitation Services will play an important role in your procedure and recovery. During your recovery following surgery, you will have both physical and occupational therapy. Therapist and/or therapist assistants will work with you on learning how to move safely and care for your new joint replacement during your hospital stay. The rehab team will also educate you on any recommended adaptive equipment needed for your care at the hospital and at home. For optimal results after joint replacement, early activity and exercise is critical. Therefore, the role of therapy is to get you up and get you moving. Occupational therapy will focus on activities of daily living such as dressing and bathing, along with recommending any adaptive equipment that you may benefit from. Physical therapy will focus on bed mobility, transfers, ambulation, stairs, range of motion, and strengthening. We'd like to say that this joint replacement becomes your new full-time job for the next few months. If you focus on doing your exercises, going for walks, and participate in your therapy sessions, you will improve your outcome. Please remember, you are personally accountable for at least 50% of your final outcome. It is your responsibility to help achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before surgery, and it will need your personal touch to fully recover. Most likely, you will need a walker after your surgery. Therapy recommends a walker that has straight wheels. There are walkers that have swivel wheels, however, those wheels move more freely and may not provide you with enough support. There are also walkers without any wheels. However, these walkers you would have to pick up with each step. If you already have a walker or are able to borrow a walker from someone, you can bring it to the hospital for the therapy staff to make any adjustments. Therapy will adjust the height of the walker to the appropriate height for you and will look it over to make sure it is working properly. You may see a few different pieces of medical equipment, like a knee immobilizer. Knee immobilizers are braces that may be ordered by your surgeon to stabilize your knee. It also helps by keeping your knee from bending. There are times therapy will have you walk with a knee immobilizer on, if there is a question on your muscle's ability to control your knee. These sturdy belts are used by staff members when you get up and move. Another safety device, these belts are used to assist you in regaining your balance if you were to lose it or begin to fall. They also help you stand or transfer if you are still too weak or groggy after surgery. Your bed will likely have a trapeze on it when you return from surgery. By pulling on it with your arms, you can reposition yourself in bed without having to use your legs. An abducted pillow is used when you are in bed to remind you about your hip precautions and to keep you from moving your operated hip in the wrong way. Leg lifters allow the arms to assist in lifting your leg in and out of bed. Reachers, dressing sticks, and sock aids. Occupational therapists often recommend these assistive devices to patients that have limited range to enhance their functional independence in daily life activities. Reachers help you by grabbing out of reach items with ease. It also allows you to maintain your hip precautions. Sock aids help you by assisting you with putting your socks on, and dressing sticks, for one example, will assist you with removing your socks. Some other adaptive equipment you may be introduced to are long-handled shoehorns, elastic shoelaces, and long-handled bath sponge. Following surgery, you will recover in the hospital and work closely with your entire team to determine the appropriate day for discharge. Pain after surgery is a normal body response. It is our goal to minimize and control your pain as much as possible. However, your pain needs to be at a level that allows you to do your exercises and therapy. This is called functional pain. Functional pain is described as pain that is not gone, but controlled enough that allows you to function during exercises, ambulation, and your recovery. The goal is to minimize and control your pain. Pain goal is 4 to 5 on a scale of 1 to 10. That afternoon or evening, the nursing staff will assist you with sitting up. The nurses will have you sit at the edge of the bed while they monitor you for any blood pressure issues, dizziness, and if you are nauseous. There are occasions when surgery happens early enough in the day. Physical therapy may come in on surgical day and get you started with some exercises, bed mobility, and/or transfers. The morning after surgery, therapy staff will come in. We are typically in your room early the next morning. First, therapy will work on a few exercises that will be discussed later in more detail. Therapy will work with you on bed mobility to get you sitting up at the edge of the bed. Therapy 2 will assess for feelings of dizziness, nauseous, and may check your blood pressure. As long as you tolerate sitting at the edge of the bed, therapy then will have you try to stand up for the first time using a walker for support. In order to stand, first therapy will have you scoot to the edge of the bed so that your feet are flat on the floor. Then prior to standing, you will place your surgical leg out in front of you. For hip patients, this helps you maintain your hip recautions. Once standing with your surgical leg out in front of you, then we will have you attempt to stand. Therapy will have you push up from the bed using your arms to assist. You never want to start with your hands on the walker trying to pull yourself up because the walker could tip backwards. This could cause you to lose your balance during mid-transfer, causing you to fall. This could lead to an injury. Once standing, you can move your hands onto the walker and slide your surgical leg back to the other leg to get yourself in a good stance. At this time, if needed, therapy will adjust your walker to the appropriate height. Fitting the walker to your height, therapy will have you stand with a good posture. Therapy will adjust the height of the walker to be at your wrist level. If your walker is not available for therapy to adjust, they will provide you with education on how to make the correct adjustments prior to your discharge. Once the walker is at the appropriate height, therapy will have you do a couple of weight shifts prior to taking some steps. A weight shift is shifting your weight onto one leg, then back to the other. You may not have 100% feeling back in your surgical leg yet, so therapy would like to assess how you tolerate this before taking a few steps. Therapy wants to make sure that your legs will fully support you. As long as you are able to stand safely, then therapy may have you take a couple of small steps to turn. To turn, you will hold onto the walker and take small steps, turning until you are lined up in front of the chair, which is placed beside your bed. To make sure you are lined up in front of the chair, you should feel the chair on the back of your legs. It's important to take a few steps and not pivot on your surgical leg. Prior to sitting down, you will place your surgical leg out in front of you again, just like you did when you stood up. You then will reach back for the armrest and slowly lower yourself into the chair. Just like standing, you do not want to sit with your hands on the walker because, again, the walker may tip back and cause you to lose your balance with an uncontrolled descent, placing you at a higher fall risk or injury. Once therapy sees that you can safely transfer to a chair, you will get up in the chair for all 3 meals. Therapy recommends that you do not sit up for extended periods of time, as this could cause you to get stiff and increase your swelling. Therapy will come back to review morning exercises and will start helping you walk based on your tolerance to ambulation. Therapy will take you through several gait or walking patterns. You will have therapy up to 2 times a day. Therapy will progress you daily in your bed mobility, transfers, ambulation, exercises, and stairs prior to discharge. Detailed information on exercises will be addressed later. Remember, up with the good, down with the bad. Prior to discharge, therapy will educate you on how to do the stairs. Therapy will have you go up and down the stairs to simulate your steps at home. After a surgery, you will likely need to take the steps one at a time, which is what some of you may already be doing. We have a golden rule that we tend to follow when going up and down the steps. It is up with the good, down with the bad. This means when you're taking the first step up, you will lead with your good leg first. This is your non-surgical leg. Going down the steps, you will lead with your bad leg first. This is your surgical leg. Remember, one step at a time until your therapist tells you different. After you have hip replacement surgery, you will need to move carefully so you do not dislocate your hip. There are 3 hip precautions. Follow these precautions until your surgeon tells you they can be discontinued. Hip precaution number 1. Do not cross your legs or ankles when you are sitting, standing, or lying down. Keep your legs hip width apart. Do not bring them all the way together. Do not sleep on your surgical hip or your stomach while laying in bed. If you are sleeping on your other side, a special abductor pillow may be used to keep your hip in proper alignment. Hip precaution number 2. Do not bend too far forward from your waist or pull your leg up past your waist. This bending is called hip flexion. Avoid hip flexion greater than 90 degrees. Think of 90 degrees as a right angle. Use helpful devices so that you do not bend too much. As described earlier, a reacher, a long handle shoehorn, elastic shoelaces, and a sock aid will help you maintain your precautions. Sit in a firm chair with a straight back and armrest. Avoid stools, sofa, soft chairs, rocking chairs, and chairs that are too low. Your hips should be higher than your knees when you're sitting. Sit on a cushion if you have to. As mentioned earlier, when getting up from a chair, slide towards the edge of the chair, place your surgical leg out in front of you, and use the arms of the chair for support when transferring from sit to stand. Hip precaution number 3. Do not turn your leg inward. What I mean, do not point your toes inward such as pigeon-toed. Keep your feet and knees pointed straight ahead, not turned in or out while sitting, standing, or lying. Do not place a pillow or a pad behind your knee when lying down. It is important to keep your hip straight when resting. Nursing may have you elevate your surgical leg while you're resting to decrease swelling in your leg. That's okay because it's also important for you to get your swelling down. Occupational therapy will be involved to teach you ways to dress using adaptive equipment while staying within your hip precautions. You will be discharged from the hospital when your healthcare team feels you are medically ready and you have successfully met your physical and occupational goals. Social services will be addressing this in more detail. Once discharged, physical therapy most likely will be recommended. Physical therapy can continue as an outpatient, home health, or short-term rehab. Outpatient therapy, if you are returning home and have the support team in place, your surgeon may recommend you continue your physical therapy on an outpatient basis. If you qualify for home health services, they will come in and provide therapy within your home. It is up to the agency if you qualify and how many times a week they will provide therapy. Short-term rehab facilities provide the daily skilled nursing care and rehab programming all under one roof. This is ideal for people that don't have enough care support in the home. Short-term rehab provides an option for recovery until you are able to safely return home. You will receive therapies 1 to 2 times a day for 5 times a week if you meet the skilled requirements. To build strength and to aid in your recovery, start doing all your rehab exercises starting today. This will allow you to become familiar with them, which will help you during your therapy sessions. Encourage your support person to go through the exercises with you, as you may need their help after surgery. There will be 4 exercises that therapy will introduce to you most likely the day following surgery. These exercises help keep the blood flowing in your legs, reducing your risk for blood clots. They also help you keep your swelling under control by pushing the fluid out of your legs. During your therapy sessions, the therapist will provide education and assist you with your exercises to make sure they are performed correctly each day. Each day, your therapist may introduce different exercises to progress you in range of motion and strength. Your therapist prior to discharge will provide you with your personalized home exercise program. The first exercise is ankle pumps. Position. Begin lying on your back with your legs straight. Movement. Slowly pump your ankles by bending and straightening them. Helpful hints. Try to keep the rest of your legs relaxed while you move your ankles. The second is supine quad sets. Position. Begin lying on your back on a bed or a flat surface with your legs straight. Movement. Tighten the muscles in your thigh of your surgical leg as you straighten your knee. Hold for 5 seconds, then relax and repeat. Helpful hints. Make sure to keep your toes pointed towards the ceiling during the exercise. Try to flatten the back of your knee towards the bed. This is the third exercise. Begin lying on your back with your legs resting comfortably. Movement. Tighten your buttock muscles. Hold for 5 seconds, then release and repeat. Helpful tips. Make sure not to arch your low back during the exercise and hold your breath as you tighten your muscles. Keep your knees flat. This is the fourth exercise. Position. Begin lying on your back with your non-surgical leg bent and surgical leg straight. Movement. Slide the heel of your surgical leg towards your buttocks, bending your knee as far as it is comfortable. Hold for 5 seconds, then slide it back to the starting position and repeat. Helpful tips. Make sure to keep your back flat on the bed during the exercise. These are the 4 main exercises that therapy will begin with you. The following will be introduced as you tolerate them. Supine hip abduction may require assistance from your therapist if you are unable to move through the complete range and/or perform correctly. I will describe this exercise today with assistance. Most likely, the therapist will need to assist you to achieve the available range and for proper form with this exercise. The position. The patient should be lying on their back. The therapist or caregiver at home should hold the surgical leg below their knee and at the heel. Movement. With assistance, slowly slide the surgical leg out to the side, keeping the toes pointed towards the ceiling. Hold for 5 seconds, then slide the leg back to the starting position and then repeat. Helpful tips. Make sure to perform this exercise slowly and keep the knees straight but not locked. The caregiver should keep their back straight to maintain good body mechanics. Do not force range and always go by pain tolerance. And assess their body language for any signs of discomfort that they might not be sharing with you. Caregivers are there to assist in the motion that you are unable to perform correctly. They are not there to do it all. This exercise, position, movement, and tips will be the same if you can actively do these in a good form on your own. Short arc quad. Position. Begin lying on your back with a rolled up towel under your knee of your surgical leg with your heel resting on the bed. Movement. Tighten the muscles in your upper leg to straighten your knee. Hold up to 5 seconds, then return to the start position and repeat. Helpful tips. Make sure to keep your back flat against the floor or bed as you move your leg. Long arc quads. Position. Begin sitting upright. Movement. Slowly straighten your knee on your surgical leg so that your leg is straight out in front of you. Hold up to 5 seconds, then lower it back to the starting position and repeat. Helpful tips. Make sure to keep your back straight during the exercise. If you have steps with no railings, therapy encourages you to have at least 1 railing installed. 2 would be ideal if possible. Having railings with your stairs will make it easier to enter and exit your home. Remember, up with the good, down with the bad. If your bedroom is upstairs, consider using a main floor room for a bedroom initially. Traffic pattern. Move obstacles such as throw rugs, extension cords, and footstools out of your walkway. Create a wide, clear path from your bedroom to your bathroom and kitchen so you can easily move about with your walker. Bathroom. Install a raised toilet seat in the bathroom if you have hip precautions or if you're unable to get on and off the toilet easily. Grab bars, tub rails, and shower chair may be beneficial as well. Install non-slip surfaces in the tub or shower. Sitting. Find a chair to sit in that has a firm, straight-back chair with armrest. A dining room chair may work if you don't have other chairs. Access to items. To avoid reaching or bending, keep frequently used items within easy reach, especially in the kitchen, bathroom, and bedroom. In case you cannot wear pants with pockets when you first return home, consider getting an apron with pockets so you can carry around your phone and other items after your surgery. If you're using a walker, attach a walker bag to the front of your walker to carry items from place to place. It is a good idea to carry a cell phone or portable phone with you at all times during your recovery. Get help with cleaning and laundry when you first return home. Have a few weeks' worth of clean clothes available to you. Small children and pets can pose a safety hazard to your recovery. Small children may need to be taught how to interact with you in ways that keep you safe. If you have pets, make arrangements to keep pets in another area of your home when you arrive. Arrange somebody to collect your mail or place delivery on hold during your stay at the hospital. Arrange for help with your meals and perishable foods. Prior to your surgery, freeze pre-made dinners and other meal items. Stock up on non-perishable foods to make it easier to prepare meals after surgery. You can also call your local Aging, Disability, and Resource Center to see if you qualify for Meals on Wheels delivery. Do not drive until your health care provider says it's okay. Break up long car rides. Stop, get out, and walk about every 2 hours. For hip replacements, you will need to be careful getting in and out of a car. You may need to place a firm cushion on your car seat, raise the seat, move your seat all the way back, and tilt the backrest back to maintain your hip precautions. Make sure to wear shoes with backs on them that can be easily slipped on and off. Do not wear clogs or sandals. Use your walker until your doctor or therapist tells you it's okay to stop using it. Your therapist usually starts you with a front-wheeled walker during your hospital stay. When you are strong enough, your therapist, following hospitalization, will transition you to a wheeled walker, crutches, or cane. Once again, please remember you are personally accountable for at least 50% of your final outcome. It is your responsibility to achieve your goals and expectations. Your recovery is all about what you do to keep moving. Your joint will be better than it was before your surgery, and it will need your personal touch to recover. In summary, we've talked about a lot of things. We talked about making sure your pain is under control. We talked about making sure you have the right walker. We talked about precautions for total hips, and we talked about the importance of the exercises and how you need to start them today to become familiar with them and to increase your strength and range of motion prior to surgery. Therapy would like to say that this joint replacement becomes your new full-time job for the next few months. You are getting this new joint replacement because you want a good outcome, right? So make sure you do your homework. Mile Bluff Medical Center Rehab Department is looking forward to helping you meet your goals. Good luck to you all.